Assalamualaikum and hi, I am Teacher Afiqah. So today I will talk about autism spectrum disorders and then I will focus about autism and Asperger's syndrome. Autism spectrum disorder ASD, or we can call as pervasive developmental disorders PDD, is a severe and complex impairment in reciprocal social interactions and social communication skills, and also by the presence of stereotypical behavior, interests, and activities. The onset is it can happen before 3 years of age, and the deficits it can persist throughout life. Next, the parts of the brain that can affect with an individual with ASD or a child with ASD are cortex, amygdala, cerebellum, and also hippocampus. So the cortex, it can affect to two parts, which the first one is right somatosensory cortex and the second one is orbitofrontal cortex. So it can happen or it can affect with an autism spectrum disorder because the function of the cortex is it is for the movement, perception, and also behavior reactions. While amygdala is one of the function is for emotional response, and cerebellum is for the muscles that use for speaking, and one of the function of hippocampus is it is to remember new information and also recent events. So these parts of the brain is a different one with the normal brains. So ASD can be divided into 5 types, or ASD includes first one autism, second Asperger's syndrome, third Rett syndrome, fourth pervasive developmental disorder unspecified, and the last one is other childhood disintegrative disorders. So autism, which is one of the types of ASD, is it often coexists with neuropsychiatric disorders. So neuropsychiatric disorders like seizures, attention deficit hyperactivity disorder, ADHD, affective disorders, anxiety disorders, obsessive compulsive disorders, or we can call it as OCD, and also Tourette syndrome. So the characteristics of autism, we can be categorized into 4 subclusters of disturbances, which the first one is disturbances in social interaction, the second disturbances in communication, the third disturbances in behaviors, and the last one is disturbances of sensory and perceptual processing and associated impairments. The first subclusters of disturbances or characteristics of people with autism is disturbances in social interactions, which we can see they show poor or deviant eye contact, like not sustained eye contact, failure to develop peer relationships, then delayed or inappropriate facial expressions, like not showing or hardly showing any emotions, then apparent aversions to physical contact, lack of social reciprocity, delayed or absent to anticipatory response to being picked up, and lack of spontaneous seeking of another to share enjoyment, and they also prefer or tend to be alone. Then the disturbances in communication, which the second subclusters, and this kind of communication it depends on the level of autism, like from it depends it on mild or to severe autism. So the characteristics is they show repetitive or echolalic, like parrot-like repetitive sound, syntax problems, atonal and arrhythmic speech, then pronoun reversals, and also lack of inflection and emotion during communication. As for disturbances in behaviors, we can see that an individual or a child with this autism show intolerance of routine activity, which are they are usually hardly to follow routine activity, and then resistance to any type of change, and the patterns of behavior we can see through stereotypical, preservative, like in pretend play, and also obsessive rituals. Pretend play is like, for example, normally kids like to play in shoppings, playing doctors, like cooking, and also being a policeman. But then a child with this autism are like in it. And then while obsessive rituals is like showing bizarre attachment to unusual objects, which for example they show intensity or too obsessed with a vacuum cleaner. And then they also show tantrums, and also we can see the deviant motor patterns, which through head rolling and banging, wiggling and flicking fingers, and also to walking. For example, to walking. Next, the four subclusters in is sensory and perceptual processing, which we can see through abnormal response to various visual, vestibular, and also auditory stimuli. And they also show oversensitive to sound, which sometimes it is the daily sound that we hear that but they oversensitive to it. And they also show over responsivity to tactile, so such as stereotypes and repetitive. They show through stereotypes and repetitive actions to that tactile. So for the fourth subclusters, which including associated impairments, mostly people or child with autism also showed intellectual impairment, and mostly they also have seizure disorders, which the most type of seizure disorders are tonic, clonic, and also complex partial seizures, and they show discontinuities in developmental rates, and also mostly they have cognitive impairment. The treatment for an individual with autism or a child with autism is it can be through comprehensive intervention, therapies, specialized educational program, and also medications. So as for comprehensive intervention, it can through parental counseling, behavioral treatment, special education, sensory integrative therapy, social skills training, speech language therapy, medications, and also medical support. As for therapies, we can treat through auditory integration training, dietary interventions, discrete trial training, medications, music therapy, and also vision therapy. And specialized educational program, which this is one of the best treatment for autism, is it can through communication therapy, social skills training, and also sensory integration therapy. And medications that used for um, a child or individual with autism is we use sedatives, stimulants, tranquilizer, antihistamines, antidepressants, and also psychotropic medications. Next, we move on to Asperger's syndrome, which is Asperger's syndrome is now usually people call it as level 1 ASD. Before 2013, Asperger's is called famous as Asperger's syndrome. So, level 1 ASD or Asperger's syndrome is an impairment in social interactions, and it shows restricted, repetitive patterns of behavior, interests, and activities of child's development. Next, obsessive interest in letters and also numbers, and they show also lack of nonverbal communication and lack of empathy. But usually, a child with Asperger's syndrome show above average intelligence, and also they show strong verbal skills, but they lack in social communication. So the treatment to a child or an individual with Asperger's syndrome, we can treat them through special education programs, assistance with generalizing adaptive functioning to a wider variety of settings, Also, we can treat through problem solving strategies, social skills training, speech and language skills training, and the last one also it can be through vocational training. I think that's all from me. Thank you so much.